I am Dr. Bailey. I am the National Assistant Medical Director for CNS Occupational Medicine. I've been practicing for 20 years, mainly in emergency medicine, but now occupational medicine. And I provide care mostly at our Georgetown campus. When scheduling your DOT physical appointment, you should ideally schedule it 3 to 5 days in advance. That gives us time to kind of get together when we need to. We can fit people in same day. It's not a guarantee. We try as hard as we can to do that to make it convenient. But yeah, some items you'll need to bring to the physical are your license or a form of identification. You also have to have your medicines that you take. It's very helpful to have a list of everything so we can go over that. Any further documentation that you would need from your doctors if you have a specific disease process, and you would know that before you got there. Then I always get asked, do I need to inform you about the medications I'm currently taking? And the answer is yes, you need to inform us about all medications you're taking. We have to review everything. There are certain medications that are weighted more than others, so we have to know everything that you take. And that does include if you're taking medical marijuana, which if you are, well, unfortunately, DOT is a federal form and a federal physical, and the federal government still considers marijuana as a Schedule I medication or drug. So you cannot get a DOT physical if you are currently smoking marijuana or using marijuana THC. Okay. Despite whether or not you have a medical card or it's legal in that state, the federal regulations trump that. If you do want a DOT medical card, you should stop using marijuana immediately and wait at least 3 weeks from the last time you smoked. Depending on how long that you've used the drug, it can show up in a urine drug test for up to a month. So what about the actual exam itself? I know people are nervous and want to know what it's like. The exam is fairly straightforward. When you come in, you'll be greeted, you'll be seen by a medical assistant. They will do your hearing, they will do your vision, and they will do your vital signs. You'll either see a physician or a practitioner that comes in, get an interview, go over your medications or past medical history, your vital signs, vision, hearing. And then once all that stuff is done and discussed, there's just a basic physical exam. Ears, eyes, nose, throat, lungs. We do a little bit of physical agility in that we want you to do range of motion, touch your toes, balance, gait, those kind of things. But other than that, it's just a basic run-of-the-mill physical. Now I hear you asking, why should I choose CNS over other providers for my DOT physical? And to be honest, the answer is so simple yet extremely effective. The basic premise is that we try to prioritize quality over quantity. We like to put the patient's needs first. Their time is special to us, and we also like to get things done that make them feel special and make them feel like this was a good experience. It is our standards and our attitude. We are always looking for quality, and we're always looking to improve that quality. Yes, we want to have patients happy and we want to do the right things, but we want to do it the best we possibly can, and we're always actually looking for something better in a way to improve. We listen to the feedback, we listen to the patients, and we continue to listen to all the new standards that are coming out. We try and make it a great process for everybody and live up to the standards for the general public, but also for our standards.